Now, humanitarian organisation Gift of the Givers is warning of a national food crisis. The organisation's founder, Dr Imtiaz Sooliman, said this week that it's now becoming the norm for people in the Eastern Cape to go long periods without food. He says starving is becoming the norm. He joins me now. Dr Sooliman, this is very distressing news. For over a year, you have been coming onto this program detailing the desperate food shortages in parts of the Eastern Cape, a lot of it due to the drought. When you spoke in Gqeberha earlier this week, you said starvation has become the norm in the Eastern Cape. That suggests it's worse than ever. Is it getting worse?
Yes, Sally, good evening to you. It's a pattern we've been following for quite some time now. During the time of lockdown, and with job losses, we were rolling out a lot of food parcels. But what has been distressing in the last few months especially is that call is not only from the Eastern Cape. We are flooded with calls from Northern Cape, rural areas of Eastern Cape, calls from the Free State, and we have soup kitchens running in many provinces, even in Western Cape itself. The number of soup kitchens are increasing. The number of people coming to existing soup kitchens are increasing. The number of times a day that a soup kitchen now needs food is a week. It's no more once a week. It's becoming 4 to 5 times a week. School principals are telling us that when kids come to school, that's the only meal that they get. And when they're going home, there's no food for them and there's no food for their parents. We're also getting calls, a lot of calls from university students who are saying they don't have food. They have transport money, they have book money, they have accommodation money, but they don't have food. And the number of food parcels that we're distributing is increasing every month. The number of soup kitchens we're supporting is increasing every month. The other distressing trend, which we found through hospitals and many areas, is that the diseases that have come back in a big way is HIV and TB. But with that, there's an increased number of reports on malnutrition. And in the Eastern Cape, we found in quite a few hospitals, children were dying. And in your introduction, when you mentioned hunger is the norm, we were trying to trace why were children dying of hunger in the Eastern Cape. And we found that adults, for them, it's quite normal not to have food for several days. And that normality then, in inverted commas, then extends to the children. But children don't survive, adults do. And when they bring the child to the clinic, it's too late and the child dies. So this crisis is going to expand more and more into more provinces, but especially into rural areas.
So explain to me why. And the reason I'm asking why is because in South Africa we have the school feeding scheme, we have child support grants, we have pension grants, plus at the moment we've got the 350 Rand a month relief of distress grant, which yes is very little, but it's better than nothing. Why are things getting worse with the network of support that we currently have?
Yeah, that's very disturbing, to be honest. But the issue is there's been a lot of job losses. Number one, there's no new jobs being created. A lot of people have lost joint income. And by the way, the hunger is not only among the poor people; it's also reached a large portion of the middle class people also, for the same reason that now there's only one family member earning. And when income is fixed, and when you have inflation, rising interest rates, rising fuel prices, a horribly high rise in food prices, it's horrendous, the cost of food, and with the cost of medical care. So people have the same amount of money, but it's more expensive to buy the same type of items. So there's less money in a middle class home, and the same thing applies to a lower class home. Also, remember, a lot of people in rural areas are dependent on money or food coming from their family members who are working in the cities, in the biggest cities. And now because they've lost their jobs or they've limited income or because for the reasons I mentioned, everything's more expensive, there's far less money to send home. So while the grants are there and while the school feeding programs and while there's everything else, but all those are augmented by the money coming home from family members or from people having jobs. And then remember, the full school feeding program only works during school time.
Yeah.
So when there's no school, there is no full feeding program. So about 8 to 9 months in a year, you have the feeding program. And of course, sometimes the money even runs out to fund the existing feeding program. And this problem started from the lockdown time because a lot of schools were closed during lockdown.
Yes, exactly, and I remember that issue being highlighted. Of course, the good work that organisations such as Gift of the Givers do is invaluable. But what else needs to be done? You know, I'm thinking of the DA in September. They highlighted their real concerns about hunger. One of the things they suggested is that more foods be zero rated for VAT, that government take a more definitive role in reducing the price of food. Are those the sorts of interventions you believe would work? Do you have other suggestions?
Well, partially it will help, but a lot of people don't have money. You know, so that's one of the big challenges. What I suggest, you know, what we're doing is we're supporting agricultural programs at schools. And, you know, and there's a lot of youth, you know, now involved, and communities where you have community gardens, which is an old story, you know, but it's more important right now to have those community gardens at schools and in communities, and to take that skill back home. Because at least if you can grow your own crops, and there should be a larger distribution of seeds to make things, and the good thing is you see more and more people getting involved in trying to provide seeds and support for individual and community and school gardens. Wherever we put boreholes in schools, we've encouraged the schools to have a program where there's growth of vegetables or planting of vegetables. That's one. The second thing, I'm going to make a call to all corporate South Africa. Each corporate should take in each department one youth, a person, you know, who's probably qualified or coming out of matric or whatever, and give them an apprentice. What the apprentice give them as some kind of stipend, it gives them independence, it gives them self-esteem, but also it gives them some income, which even if it's 2,000 a month, would at least provide food for a family. And it's a tax expense, it's a business expense. If all of us can absorb one or two youth in every department in our companies, we will make a huge difference. I spoke to Agri-SA last week at the function, and I've asked farmers to even take in youth. And if they take in youth again, upskill them, teach them the skills of growing crops and food, and they take those skills home. So that is the cheapest form, because even if you zero rate, you need some money to buy that, whether zero rated or not. And if there's no income and there's job losses, what happens? And that's a huge challenge for the country. The jobs have to be created, and it's going to come from the private sector. It's not going to come from government.
Thank you so much for speaking to us this evening, Dr Imtiaz Sooliman, founder of Gift of the Givers.